UK don ban health workers from naija to jakpa enter their country o. My people, I greet una. Welcome una to this our channel. The tori wey we carry come today na about health workers for naija o. For some time now, una know say some Nigerians dey find different means to jakpa from Nigeria, especially our health workers dem. To the extent we no dey gree see doctors to treat us again for our Nigeria hospitals. Na so World Health Organization and lawmakers dem don draw alarm say Nigeria dey face pressing health workforce challenges. Anyway, my people, make I leave una, make una watch this video where one public health expert come analyze this whole matter for Arise TV News. So yeah, make una watch the video.
The UK does not exacerbate existing health and social care workforce shortages in the country of origin. Let's break it down in simple terms.
All right. Thank you very much. Before we talk about how we arrived here, we need to go back to the root cause of the problem. Right. This problem started long before now.
Before COVID?
Yeah, before COVID. When British government pulled away from European Union, so a lot of healthcare workers in UK left, especially those from the European, within the European Union axis. We have the French workers and the German workers who are active, expats in UK. They left, so giving room for UK government to now resort to African countries to look for healthcare workers that can work for them, to replace those people that left. So now, that led to mass exodus of international migration of healthcare workers, especially from the Nigerian setting. People moved away from Nigeria, migrated from Nigeria to UK because the opportunities are there, the working environment is good there, so the salary too is good there. So they have to move. Now, because of the COVID-19 disruptions, to which affected a lot of things within the healthcare system, affected healthcare systems very well, UK have to accept them, provide these opportunities for them to move out. So when they got there, they left a lot of gap here because we now started having shortages of healthcare workers in Nigeria, and it is having negative impact in our healthcare system. Now I'm coming. We are having the next disease X, the next pandemic is very, very close because of random variation of the ecosystem, which has now given room for emerging pathogens to come in. So, and WHO understands this thing very perfectly. So they started doing what we call health workforce index analysis through the advisory group, which was hosted last month, 14th March. They published their report on the 14th of last month. Now, what was the agreement? They said, if we don't do something about this, people will continue to emigrate, and the healthcare systems in low and middle income countries will begin to suffer. And when they begin to suffer, the next pandemic, which is very, very close, because of the climate situation, current climate situation in this planet it will affect the healthcare systems in these low and middle income countries, and also the universal health coverage, which is another sustainable development goal of the UN, which WHO is also a partner to it. They will not achieve that universal health coverage by 2030 if they continue to allow healthcare workers from low and middle income countries to continue to emigrate.
Right.
No, I'm sorry. Okay.
Yeah, because I mean, just so that we can get as many points in as possible. Now, this is, the UK trying to help countries like Nigeria and other African countries to, improve the low health workforce that it already has. This move, will it really stop brain drain? Because there seems to be a caveat by the UK that says look, this does not prevent individual health and social care personnel resident in countries on the red and amber country list from making a direct application on their own behalf. It doesn't stop that.
Yes.
So if the UK says, look, agencies can no longer come to Nigeria to recruit, but individual health workers can always, apply directly to work in those countries. How much difference really will this make to the issue of brain drain?
Exactly. That was the issue I'm trying to,
Fantastic.
because why WHO made that, because all these things centered to international politics, to be honest. Why WHO, the UK government took this decision because WHO released that publication, and UK is part of the UN system too. So they have to act because WHO publication did not say that we are stopping international migration of healthcare workers. No, what they said is government to government agreement. Before you recruit any healthcare worker from any source country, you have to engage the ministries of health. That is part of the recommendations they made. You have to engage the ministries of health to be part of the arrangement, so that when those health workers are leaving, so that they will analyze to see whether the health workers living from the source country will affect the healthcare system development in that source country. So they are not trying to stop, total recruitment or healthcare migration from healthcare migration from source countries. No, that's not what they're saying. What they're saying is there has to be a protocol so that it will not have a negative impact on the healthcare system of the source country.
You know what Ungos is trying to say here is looking at the last caveat in that release by the UK. Specifically, I'll take that again, and it says, if you look at it, it says the individuals active recruitment isn't permitted unless there is an agreement between the government of the nation on the red list and the UK government. And the last one there says individuals can apply on their own. What it means is UK healthcare companies can no longer come to Nigeria, but individuals. And already you said something about the environment, which is conducive, which is also it has some exciting.
All the facilities, everything that needs to be in place.
You already know that the individual.
That is a window. They are creating a window.
Now you're there.
Yeah, you understand? They are creating because, to be honest, you said something about the bill being passed by the House of Representatives. Yes. When I saw that bill, to be honest, I laughed. It's a bill that should be that should retire itself as an inconsequential resident of the dustbin of legislative history. It makes no sense.
Why? Because everything seems to be working together.
No, it makes no sense. Do you know why I said it makes no sense?
Yes.
They are acting against the fundamental human rights of those doctors and dentists, and that is why that UK allows that window opportunity at the so that those individuals on their own volition, you can say, the working condition here is no longer attainable for me. I want to go. It's their human right.
So which brings me to the question of how do you now stop this brain drain? How do you ensure that this, the WHO did this listing on March
14th March.
Yes, just last month.
Yeah.
And it came out with a report saying that 54 countries, including Nigeria, are facing the most pressing health workforce challenges related to universal health coverage. So the fact is there is a challenge with the health workforce in Nigeria and other countries like So how do you stop this brain drain beyond this the UK, the WHO interventions?
Thank you very much. First of all, you have to improve the salaries of these healthcare workers, especially doctors and dentists. Now, there is a pool that was organized in 2018 as to why doctors and dentists are immigrating out of Nigeria. It's very simple. They said high taxes. 98% of them that was involved in the pool said 98% said high taxes and deductions from their salary, poor working environment. One of the doctors, an ONG, obstetrics and gynecology, said that a protocol that would take her for 5 minutes takes her 45 minutes. Why? Because the equipment is not there. okay, my firm is organized. I'm doing a quality healthcare assessment on healthcare facilities in Nigeria. When you go there, it's an eyesore, to be honest. Sometimes you see doctors doing a protocol and you find out there won't be light in government hospitals. Now, and what they do is they go and start begging international organizations to provide solar and all that. That's an embarrassment, to be honest. And then there's budget for this thing. So they have to improve, upgrade local facilities too, local healthcare facilities. You go to the other day, one of the hospitals, I don't want to call names, one of the hospitals in MCT here, did not see a pregnant lady was there, trying to give, and he was in 4 cm since 11 p.m. till 9 a.m. when I got there, and these people were dancing. Nurses.
Because we're out of time. You know, the question was
I'm trying to pick. I'm coming.
All right. Because if we can do this in a minute.
Fine. So now they have to upgrade the facilities. They have to improve on equally training of the healthcare workers, especially doctors and dentists. Some of these, they don't know the current protocols coming out in the healthcare system. So they have to, training, formative empowerment. It has to be there. 3, I think President Buhari should be the last president, to undergo medical tourism in Nigeria. Right. And especially healthcare of government officials, especially when they're going to be treated with taxpayers' funds, by restricting them from going abroad to undergo healthcare treatment. If they are to do this in Nigerian hospitals, you will see Nigerian hospitals, like if the Senate president goes to maybe a Sokoro or Maitama hospital, or even national hospitals to be treated, and some of these things are not there, it will lead to what? Improvement. Yeah.
My people, now the video be that too. Anyway, make una drop on a comment for the comment section. I wanna reason all this whole matter. And not forget to like and share this our video. Now do well. See you all in our next video. Bye.
Welcome to DJ TV. DJ TV. DJ TV. DJ TV.
Some of the delegates and ask the question.
DJ TV. DJ TV. DJ TV.